Now to our top local story. State leaders here in New York taking new steps today to combat the opioid crisis.
The Interagency Overdose Prevention Task Force holding its first meeting earlier this afternoon at the Empire State Plaza, with the latest information indicating the crisis is getting worse. According to data released earlier this year by the State Department of Health, the number of overdose deaths in New York increased by 14% between 2020 and 2021. Opioid-related emergency department visits went up by 12%. Use of naloxone, which is used to reverse an overdose, also increased.
And experts say that it'll take a multi-pronged approach to stop the flow of illegal drugs and provide treatment to those suffering from addiction.
News 10 ABC's James De La Fuente has more on the role this new task force will have.
Today, the New York Interagency Overdose Prevention Task Force met for the first time. In an effort to combat what leaders in our area are calling the worst epidemic of this kind, the governor's office created a task force of some of the top figures from across the state.
It's about all of government working together, like we do with the pandemic, to try to solve a really big problem.
We need to focus on harm reduction, because that's really about keeping people alive.
The task force is designed to expand and enhance programming, develop innovative initiatives to support life-saving care and services.
So definitely all of the health-related agencies are included: education, first responders, law enforcement, criminal justice, social services. So really any place where people with addiction may touch systems.
Local mental health agencies and law enforcement officials dealing with the issue firsthand say it is a step in the right direction, and it is something they've been asking for. They shared with me what they hope will come from the new task force.
I'd like to have a creative public education campaign that would be throughout the state. From a treatment perspective, I would want to see that we develop skill sets in the workforce, so there would be one door for people to come into. If you have mental health concerns, if you have addiction issues, you could be treated at the same place.
Barriers to care and things are always really, can be frustrating for people on the front lines, and I know that they're going to be working on those.
The task force will have 6 more meetings and will issue a final report October 15th. Reporting in the Capitol, James De La Fuente, News 10 ABC.
There are resources available to people struggling with addiction. We have listed a few on your screen. Naloxone can be found at pharmacies around the state. And if you or someone you know is having a medical emergency, go to the hospital or call 911. The task force will hold more virtual meetings. If you'd like to have your voice heard, you can participate in public comment. We have those details on our website, news10.com.